Go.
Okay. Hi, I'm Elizabeth. I will be assessing Holland today, doing a head-to-toe assessment of her.
I'm Holland. I'm a senior. I'm 18. I go to St. Catherine's School.
And I do have Holland's permission. I'm going to give verbal permission.
Yes.
It's okay. And we also have permission from her mother. Okay, so we will go ahead and start. I'll perform hand hygiene and wash my hands. I've also provided privacy for Holland by closing the door. We're going to start with vitals. So let's go ahead and take your blood pressure. Just relax your arm. Okay, it's 100 over 75, so that's appropriate. I'll write that down. Let's get your oxygen saturation and your heart rate. All right, so your heart rate is 68 and your O2 sats are 97%. So that is perfect for your age. Making sure temperature. Okay, under your tongue. There you go. Okay, it's 98.5, so it's appropriate. Okay. So now we are going to, I'm going to ask you some silly questions. So I want you to tell me your name
Holland.
and what's today?
Monday.
Monday. Do you know the date?
March 4th.
Do you know where you are?
St. Catherine's.
And do you know who the president is? Obama. Okay. All right. Now we're gonna check your cranial nerves. So I want you to read a few words from this.
Going beyond green to be clean.
Okay. All right. Did you have any trouble reading that?
No.
No. Okay. Let's check your eyes. So I want you to look at me. I'm gonna check your pupils. Okay. They're reactive to light. Now I want you to follow this with your eyes, but don't move your head. Okay. Pupils are round, reactive, equal to light and accommodation. Let's continue with your cranial nerves. How many fingers am I holding up? 2. Okay, good. Can you stick out your tongue at me? All right. Can you smile at me? Okay. Good. All right. That's great. Can you hear this?
Yes.
Yes. Can you hear it now?
Yes.
Okay, great. All right, let's do some head turns. So I'm going to put my hand on your face, and I want you to push your hand against my face. Push your face against my hand. Okay. Let's try this way. Okay, good. All right. Now I want you to shrug your shoulders up, and I'm going to push down. Okay, perfect. All right. Now I want you to squeeze my fingers as hard as you can. You're not going to hurt me. All right, good. Okay, now ball up your hands. All right, now push against my hands. Okay, that was equal. All right, and that's equal as well. Okay, so now let's have you lie down. Some of this stuff. Okay, all right, I'm gonna hold up your leg. I want you to push down. Okay, push down with this one. Okay, good. All right, now I want you to push against my hands. Perfect. All right, you did it. Okay, so I think you're in good shape. Now I'm going to listen to your neck. Yeah, you can stay lying. Okay. I'm going to check your carotid pulse. So can you turn your head to the left? Okay. All right. I don't see any venous, jugular venous distension, and I'm going to listen to her carotid now. Okay, so I don't hear any extra heart sounds. Okay, good. All right, turn your head this way. Okay, it's all good. All right, let's check your capillary refill. All right, she's got brisk capillary refill in both hands. All right, and let's check your pulses. They're equal and bounding. Okay, brachial pulses are equal as well. All right, I'm not going to check her femoral pulses, but I would be doing that right here. Okay, all right, let's bend your knees slightly. Are equal. All right, just relax your feet. Okay. Dorsal pedis pulses are equal. Pulses are equal. Her skin is warm to touch. It is moist and warm in all extremities. And we'll check her skin turgor. She's got good skin turgor as well. Okay, now let's check for edema. I see no signs of edema in any of her extremities. So I'm going to move on to her heart. Listen to her heart. Started in the aortic and I'm going to the pulmonic. Then Erb's point. Tricuspid. And mitral. Okay, so S1 and S2 are all stated and no abnormal heart sounds were noted. Okay, so let's go ahead and listen to your lungs. Just take a deep breath. Okay, can you sit up so I can listen to your back? Okay, all right, her lungs are clear to auscultation. All right, you can lie back down. I'm gonna feel your abdomen now. Actually, I'm gonna listen first. I'm going to listen for bowel sounds and for vascular sounds. vowel sounds are present. Vascular sounds are present as well. So now I'm going to palpate. I'm going to start with light palpation and then move into deeper palpation. Okay. No abnormalities are palpated. Did you feel any discomfort? No? Okay. Great. All right. So in summary, Holland is alert and oriented ×4. She has an appropriate and positive affect. Her vitals are within normal limit for her age. Her cranial nerves are intact and equal. Her skin is warm and intact. She has equal bilateral grips and strength. Her pulses are all present. S1 and S2 are oscillated with no abnormal heart sounds. Her lungs are clear to auscultation. GI sounds are present in all quadrants. She denies tenderness to touch in the abdominal region. So she's in good health. You can sit up. One clinical prevention strategy for a girl this age would be to increase water intake at this time of year, especially as it starts to get warmer. It'll prevent hydration and just make you feel good. So one way that I try to remember that is the 8x8 rule. So you want 8 8-ounce glasses per day. So if you can remember the 8x8. So that is about it. Do you have any questions for me?
Don't have any questions.
Okay, all right. Well, thank you for doing this.
Okay, I can turn it off?
Yes.
Okay.